Good evening, everyone. You are in listen only mode for the beginning of the call. This is being recorded for future use. Please type questions that you want to be answered into the chat box. Sora Price Rollins, I will turn it over to you to start off the program.
Okay, thank you so much. Good evening, everyone. Thank you for attending tonight's webinar, where we aim to highlight the importance of screening for cancers and immunizations to preserve our individual health and to improve the health of our community. My name is Ruth Price Rollins. As president, I bring you greetings from the Greater Cleveland Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I welcome you to tonight's webinar that is hosted in collaboration with the Cleveland Clinic Community Health, Cleveland Clinic Taussig Cancer Center, the Cleveland Department of Public Health, and Cuyahoga County Council. We hope that this provides you with information to keep you and your loved ones safe. And at this point, I will turn it over to Councilman Pernell Jones Jr. to bring greetings from County Council Ward 8. Thank you and welcome.
Thank you very much, and good evening to everyone. It is a pleasure to be here with you this evening. I just would like to just acknowledge all of the partners here in the fantastic work in this very critical and important issue of health screening and immunization. I am the Cuyahoga County Council President, again at the county level, not city, but again, the county level. I have served for the last 10 years, replaced our former commissioners after the challenges that we had in the county 10 years in the past and the corruption scandals. But I've been blessed to serve for these last 10 years. And we've had two mandates, that is economic development to grow this economy, and health and human services, human development, as I like to say, economic development and human development. And in that human development, it means meeting the needs of the most vulnerable people in this community, those who have struggled with drugs, alcohol, poverty, their health. And in that area we have provided funding to local hospitals. We have a long and storied history of partnership with Cleveland Clinic and again, our entire health industry. And again, I say this is an important issue of again, healthy women building a healthy community. I have been married to my wife, Tammy, for 22 years. And we personally know the challenges and the anxiety and concern when you know you need that screening, and we've faced that. And she's had those screenings and been given clean bills of health, but it was important to be able to after having gone through that to know that these opportunities are available. So I am excited to hear more about what's going on today. And I just just commend everyone who is participating today. So I'd like to at this time turn it over to Meredith Turner.
All right, thank you, Councilman Jones. And thank you all for joining in. I will co-moderate this evening's session with Tangela Walker McCullum. I have the pleasure also of introducing our speakers for the evening. Dr. Lynn Milliner is a pediatrician at Metro Health Medical Center and the medical director of the City of Cleveland Department of Public Health. She is a graduate of Case Western Reserve's University School of Medicine. She has spent over 2 decades caring for children in our community, offering her medical expertise through service on medical boards and advancing the profession of medicine through research and health policy. We are so fortunate to have you with us this evening. Dr. Milliner is a proud member of Delta Sigma Theta Sorority Incorporated. Director Frances Mills is the Community Health Initiatives Director with the City Cleveland Department of Public Health. She joined the department in this capacity in 2017. Commissioner Mills provides leadership and oversight of the Cleveland Office of Minority Health and the Healthy Cleveland initiatives, whose programs inform, educate, and empower individuals, organizations, and communities on chronic health issues impacting persons of color. She assists in building capacity among health-serving organizations and works to improve health disparities, eliminate health inequity, and advance health equity in Northeast Ohio. Linda D. Bradley, MD, is a professor of OBGYN and reproductive biology at the Cleveland Clinic Lerner College of Medicine at Case Western Reserve University. Dr. Bradley's clinical work includes Director of the Center for Menstrual Disorders, Fibroids, and Hysteroscopic Services. Recently, she was appointed Vice President for Diversity and Inclusion for the Cleveland Clinic Women's Health Institute. She is an internationally recognized gynecologic surgeon known for her expertise in diagnostic and operative hysteroscopy, saline infusion, sonography, evaluation of abnormal uterine bleeding, and alternatives to hysterectomy. She was recently elected to the board as medical director for the American Association of Gynecologic Laparoscopy. She serves on the Cleveland Clinic Board of Governors. She has been chair of the OBGYN section of the National Medical Association and president of the Cleveland OBGYN Society. Dr. Bradley was president of the American Association of the Gynecologic Laparoscopists as well. For the past 18 years, she has been a dedicated servant leader in Cleveland's multicultural community and wellness programs. She is the founder of Cleveland Clinic Celebrate Sisterhood and Cleveland Clinic Soul Steppers. Tangela?
Thank you. Panelists, we are excited to have you here, and we want to get started so that we will have enough time for the audience questions, Q&As. So we're going to get started. The first question is going to go to Dr. Milliner, excuse me. Dr. Milliner, here we are almost 2 years into a pandemic and still seeing surges of COVID-19. What is it going to take to move us out of this pandemic, and what do we need to do as individuals?
That's an excellent question. And first of all, thank you to all the committee members for this invitation to still continue the COVID discussion and healthcare screenings for our population and our community. Fair to say that we are all suffering from COVID fatigue. And as much as we are done with COVID, COVID is not done with us. The recent surges have indicated that despite our attempts to get people vaccinated and to do the right things, we still have to be mindful that not everyone has gotten vaccinated. Not everyone has chosen to be vaccinated. And to be honest, COVID is very smart about making itself as transmissible, contagious, as represented by the recent variant as it possibly can. So we need to continue to do some of the things that have protected us all along this entire almost 2 years now. So the 3 C's: avoid close contact, avoid crowded spaces, and make sure you clean frequently. If you're not able to get vaccinated or choose not to, it's important that you change behavior to protect yourself and those around you. And then remember, vaccines are very safe and effective in preventing COVID and severe disease from COVID. Very few of us have not been touched by COVID or have a loved one touched by COVID. So the things that are in our power to do, we encourage you to do. Get the right, accurate information from your trusted healthcare leaders, not celebrities or people that don't have accurate information, but important that you do talk to your healthcare providers, get your screenings, as we'll talk about in a little bit later. Because of COVID, we put our health on the back burner. And it's really important that COVID isn't the only issue that we have to deal with. We as a people are very poor, we're very sick, we don't have great access to care. And now more than ever, we need to take care of ourselves and those around us as much as we can.
Thank you. Okay, the next question is for Commissioner Mills. Commissioner Mills, I have a similar question for you. 2 years into the pandemic, how is the Cleveland Department of Public Health assisting in the pandemic response?
Well, when a pandemic like this hits the community, the first thing that you have to do is mobilize. No single entity, health department, hospital can cope with all of the issues that are presented in the community. And so the first thing that we had to do was partner with all of the hospitals in the community, the other health department, so many partners within the city of Cleveland, across the city, to mobilize a campaign first to inform the community, also to vaccinate the community, and to partner with others that were principal in the testing effort. And so when I say mobilization occurs at the beginning of the pandemic, there were multiple meetings daily to craft responses to the community in terms of answering questions about what is COVID, how severe is COVID, how will we report information to the community, and then how will we test the community, and how will we vaccinate. And so the city of Cleveland, certainly along with the partners, were involved in those conversations. But when we began to get our first doses to the community in December of 2020, we began to execute. And so for us, that meant that we set up mobile clinics in the community through our recreation centers at Public Auditorium to meet the demand for the vaccine as it was rolling out. As the pandemic has progressed, we have continued to provide clinics. I think up to last week, we have provided over 250 mobile clinics in the community for individuals who have wanted to get vaccinated. We provide standing clinics. The city of Cleveland has 2 health centers, one on the east side, one on the west side, the J. Glenn Smith Center on the east side, the McCafferty Center on the west side. We're providing standing clinics not only to provide first and second doses, but now to begin to provide booster doses in the community for those individuals who need that booster dose. We've also partnered with others to ensure that messaging, general messaging, goes out through billboards, radio, television, providing webinars in which community members can ask questions about COVID, to establishing a call center, as our other partners have done, to answer questions about COVID as well. And so this work is continuing. We thought that when the summer months were beginning, that we might see some light at the end of the tunnel. But when the July 4th holiday happened, we saw that surge that we're still dealing with, and are now just seeing some incremental decreases in the number of new cases. So we've been very active for the last 18 months, and we anticipate we will continue until things get better.
Thank you. Okay, the next question is for Dr. Bradley. Dr. Bradley, October is Breast Cancer Awareness Month. It is also a time where many people may be getting the influenza vaccines. It seems like we are being urged to do a lot of things. Why is screening for cancers and receiving vaccinations such as influenza and COVID-19 so important?
Thank you very much for this invitation, and also thank you for inviting me to speak. What I would say is one of my favorite quotes from Maya Angelou. When you learn, you teach, and when you get, you give. And when you know better, you should do better. So we know as Americans that prevention of this disease takes a lot of self-care, self-compassion, and testing. And we are very fortunate that we have diagnostic testing and ease of getting scheduled for many of the tests. So this month, October, you're right, is Breast Cancer Awareness Month. And if we all live long enough, 1 out of 8 women, by the time she gets to be 90 or 100, will develop breast cancer. Not all breast cancers are fatal. Some are in situ, some are indolent, meaning they just last and last. Yes, there are 281,000 invasive cases of breast cancer, 49,000 cases, and about 43,000 deaths. And breast cancer also occurs in men. It's less likely, but if your father, grandfather had breast disease themselves, should put you at greater risk. 85% of breast cancers do not occur in families. They're sporadic, only 15%. And the beautiful news about today, compared to when I started training many moons ago, most breast cancers today are not picked up by your own self-breast exam, but by mammography. The idea is to pick up the disease when it's smaller than you can feel it, or your physician can feel it. And this is why mammography is important, and that it seems logical that the smaller the disease burden, the more likely you will be able to live. So the idea is to be screened. More important for women of color, one of the barriers that we are seeing is you get screened, the doctor sends you an email, the nurse calls you, someone says, you need a follow-up mammogram. This happened to me a few years ago. My mammogram was not normal. I needed to get what's called additional views. And then depending on that, for me, the report said I needed to have a breast biopsy. Okay. And so what I needed to do was to go back and respond to the letter, to the note, to the my chart, and schedule. So what we're finding for women of color, Black and brown women, if they're screening, there's a higher chance that we are not following the recommendations. So if you're asked to go back and get the extra views. Most of the times, the extra views are normal. But if you don't get it done and there's a problem, then there's a delay in diagnosis. So for breast cancer, I would say screening is important. I personally disagree with the American, oh God, there's so many, gosh, I think it's the breast cancer awareness. There's a national organization that says, oh, you don't need to do self-breast exams. As a doctor, we follow guidelines. Guidelines are not rules that have to be followed. Guidelines are just giving you guidance. It takes 2 minutes to examine your breasts in the shower, lying down, having your partner know your breasts and check. And so some people would say it doesn't make a difference. You should know what your breasts look like, what they feel like, how it looks different. Is there itching? Is there a nipple discharge? You need to squeeze your nipples to see if you see blood, milky secretions. And if you're still menstruating or even pregnant or postpartum and you see something different, you should be able to go speak with your physician and be extremely diligent to making sure that you're heard, and that, oh, because you're 31, oh, you just had a baby, that you're going to be brushed off. Be persistent, be aware, be knowledgeable of your body. So I would just sort of sum this to say that breast disease is common. It's not a death sentence, and we are picking up the disease earlier. Many different treatments are available. So I would say it's important, and you should put yourself on your calendar. Don't forget, and most important, don't forget to follow up. And if you're available, take a friend, phone a friend, bring a friend, remind a friend. I think that's important. And then secondly, for the flu vaccine, I just had mine last week. These are all preventable diseases. If you ask your grandmother, great-grandmother, great-great-grandmother, people died from things like tetanus, lockjaw, died of polio. We forget about the iron lung. People died from meningitis. We died from measles, mumps, chickenpox. We just have a new vaccine for malaria, a very common cause of death due to diarrhea and under-resourced, as we used to call third world countries. So the idea of getting either vaccine, as Dr. Lynn had spoken about, Milliner had spoken about, as well as the flu shot, it's important. And these have been tested, they're safe, they're meant to keep us alive. And don't forget, ladies, and the few men that were there, in the 1850s, how old did most women live to be? 43. Most women were dead. They didn't even make it to the menopause. And they died of preventable diseases that now we don't need to die from. Many of them infectious and viral, and of course, childbirth. And that's a whole nother story. So I think, our memories are short. We forget, the flu of 1918, unless you're a big history buff like I am, and to see what happened when you read those textbooks. So we're here, things are studied. We are not experimenting on people. This is not the Tuskegee experiment for flu shots or for the COVID-19 vaccine. These are safe, effective vaccinations that we need to embrace. And again, when you know better, you should be doing better.
Thank you. Okay, our next question. We are going to go back to Dr. Bradley. Sorry, I lost my place. Dr. Bradley, can you explain the vaccine hesitancy and how can it be overcome?
Actually, I think that's me. Is it for Dr. Milliner or Dr. Bradley?
Give it to
I'm
me.
sorry. Yes, that's for Dr. Milliner. I'm so sorry.
That's
Dr.
okay.
Milliner.
Thanks, Dr. Bradley.
I'm sorry, Dr. Bradley.
At its base, vaccine hesitancy is the reluctance, refusal, inability to accept getting a vaccine. And as you know, we live in a 24-hour news cycle. So we are much more now the victim of a lot of information. I still manage Metro's COVID hotline, and I am still bombarded with people that, 8 months, 10 months into the vaccine, people are still confused about what they should listen to. We want you to listen to your trusted sources. The reason why people get vaccinated is very easy. That's the easy part. I always want to meet people with the why not they're getting vaccine. And if I can educate and enlighten and inform, it's not a debate. We have to remember that COVID outbreaks and pandemic outbreaks are public health decisions. We recognize that people make private health decisions, but those decisions have consequences. So it's not just important that you individually get a vaccine. You should get a vaccine to protect others around you, and recognize that if you choose not to get trusted information, I always like to throw a little humor in. I'm sure Cardi B researched her physical enhancements more than she's researched the COVID vaccine, but we listen to people like our athletes and our celebrities, and we listen to their opinions and we're swayed by them. So it's really important, if you have questions about the vaccine, even now, that you trust the science, not the emotion, that you have a trusted healthcare partner. And if you don't have one, now is a great opportunity to get yourself affiliated with a partner that can discuss it with you in a safe environment and answer the questions you need to have answered, so that you make the right informed public health decision. That's the only way we're going to get out of the pandemic. It's not going to go away anytime soon. There will always be more variants. COVID is very smart. It doesn't care about our feelings, our emotions, our personal choices. It's going to be out there to infect as many of us as it possibly can. The only things we can do is keep ourselves safe, avoid crowded spaces, get vaccinated, and make sure we make the right decisions so that we're not exposing ourselves to others. It's going to be here for a while. And I know we all want to get back to doing the things that we love to do and social things. But until COVID gets done with us, we have to get ready to be done with COVID and keep ourselves safe and all of our community around us safe as well.
Thank you, Dr. Milliner. Okay, our next question is for Commissioner Mills. Commissioner Mills, we have heard our physician panelists talk about the importance of screenings and vaccinations as primary prevention. We have also heard you discuss we have also heard you discuss the Department of Public Health and what you are doing to help the community during the pandemic. We hear many reports of the public health system being underfunded. Can you please explain what that means and how this impacts health promotion and primary disease prevention efforts?
That is a great question, because most people really don't understand the impact of public health in a community and in society in general. Sometimes I've heard it said that, public health saves lives every day, simply because we work to identify community health problems and to make sure that the community is informed about those problems. We follow up on flu, HIV, STIs, and we're responsible for mobilizing partnerships with others who provide the same work, providing linkages to people who need health services, and making sure that services are accessible to the community. Infrastructure means that we have a workforce that is available, and competent to do those things, that we have systems of communication to not only collect, but also to report data, and that we're able to respond. And so public health infrastructure really allows us to respond appropriately to the health needs of a community. And what COVID has taught us is that the public health system wasn't as ready as it could have been in mobilizing response and providing communication and data to the community. One of the things that we dealt with very, very early on was not how many cases of COVID there were in any given community, but who those cases were impacting. And so there was a great need for information. How is COVID impacting communities of color, specifically African Americans, Latinos, Asians? And so a great deal of work had to be done to collect that data and move it back out into the community so that the community could be informed. It wasn't just a challenge for the Cleveland Department of Public Health. It was a challenge for the County Board of Health, the Ohio Department of Health, and health districts across the country. And so in order to have a good public health infrastructure, you have to have staff, you have to have technology, you have to have the capacity to evaluate services and to explore innovation. And so when we say public health infrastructure, is the system capable to effectively respond, whether that response is to COVID, whether it is to HIV, whether it is to mosquitoes and their impact on a community, can we respond effectively? And that's what public health does. And I'm hoping that I answer that question. When it comes to health promotion, you have to have data in order to do health promotion. You have to have qualified people in order to do community-based education, whether it's in the form of community health education workers, community health workers, and you have to be able to have a response to the need for screening. What we learned during COVID is that for very credible reasons, when folks were not able to go to the doctor to get their screening, when that was over, when hospitals began to accept patients back for appointments, people completely disconnected. And so we saw individuals, A, not getting those screenings, B, when they went back to get those screenings, they were in a further stage of disease than they would have been had they been able to respond quickly and get back into screening. And so these were conversations specifically around cancer that we've been involved with all three hospital systems, with Taussig Cancer Center, with UH's Cancer Center, with Metro, and really having a unified message, the American Cancer Society. How do we get the message out so that individuals will come back and get their screenings? Because it's critical, whether it's breast cancer, colon cancer, lung cancer, prostate cancer. These are diseases that are certainly impacting disproportionately the African American community. And so getting that message out and getting people where they need to be in terms of screening, appropriate and timely diagnosis is key. And so that's what not having a strong public infrastructure, it can have an impact on what you're able to do in the community and how you're able to partner with people and get people where they need to be.
Thank you, Commissioner Mills. Okay, our final question before going to the audience Q&As is for Dr. Bradley. Dr. Bradley, in the media, we continue to hear about staffing crisis that the hospitals are facing. Will there be delays getting screenings and immunizations based on these shortages? And should the public be concerned about these shortages?
Well, I can say right now, because I live at the Cleveland Clinic for the last 3 decades, we're not seeing that at our institution, but we all have heard that there are issues. I think we are looking at training many people to do phone calls, to do triage. That is a possibility, especially I believe in more rural areas where there are fewer physicians and then nurses and nursing assistants. I think in the greater Cleveland community that we have not really seen that in any major way. There are a lot of people that are volunteering to go to some of the remote communities, med students, nursing students, sometimes to do things that you don't need a full degree for, but can be trained almost on site to do certain kinds of things. So that's always going to be of concern, but I don't think that we're seeing that now. You had a second part to the question I may have missed. So I don't think that there's an immediate, but a very much a possibility. And then
Okay, yes, the second part was, should the public be concerned about these shortages?
Oh, absolutely. I think we have to, you know, the workforce, like everyone else, our essential workers, physicians, nursing, phlebotomists, the reality of having burnout is really very real. I think hospitals are looking at the well-being of their employees to keep people able to come to work, to make sure that they're working.
Let me know when that,
Oh, sorry. Making sure that we can staff these kinds of things, being very innovative in staffing and things like that. So I think there's, I don't want to say that there's no concern, but yes, we have heard around the country and in smaller areas where there have been problems. And even the more important issue right now are beds. If all of your hospitals are bedded by the unvaccinated that take up beds in the intensive care unit, we know where car accidents, gunshots, people falling down, breaking a hip, all kinds of random things that require that you go to the emergency room or get admitted. A woman having a baby that's supposed to be a normal delivery that ends up with a complication and needs to have an ICU bed. You know, again, there's only a certain number of beds, only a certain number of ventilators. And so we want to keep the people that need us the most able to use our facilities. And certainly this issue of having so many unvaccinated people in the hospital can create shortages in many ways. So again, staying healthy is quite important.
Thank you. Okay. So I'm not sure who's taking Meredith's place. I'm going to turn it over to, can't remember who's taking Meredith's place at this point.
Hi, it's Cicely Philpott. We said that we were going to have question and answers from the audience.
Yes.
And I think two of our partners are going to be looking at the chat to see what our questions and answers are, or questions so that we can, questions from the audience so that we can answer them. We can have the doctors answer.
Sure. So this is Chantel, and I'm going to start. This question is for Commissioner Mills. How can community organizations help with immunization?
Well, we have a robust team of volunteers who do a number of things, from walking in community, doing door knocking, and stopping by businesses, providing information about the availability of clinics in the community, to individuals who participate in, they may help us collect data at a clinic, they may serve as a greeter at a clinic, or we have individuals who offer to provide interpretation services for individuals who don't speak English. So there are many, many opportunities, unloading and unloading, packing up, collecting information, distributing water and snacks after a person is vaccinated. And so there are many opportunities for individuals if they want to help or host a clinic at their site. If they're a business, we do a number of vaccination clinics with restaurants here recently. We have done vaccination clinics with providers that serve young people We've done vaccination clinics in the community at Metro Parks. We did one at Metro Parks several weeks ago. And so there are many opportunities for individuals to get involved, whether it's helping to spread the word or actually serving at a clinic site. And if they're interested in participating, all they would need to do is call our call center at 216-664-2222, and we would link them with our volunteer coordinator.
Thank you, Commissioner. Dr. Bradley, this question is for you.
Okay.
Can you speak more about the importance of pelvic examinations?
Well, pelvic examinations have many purposes. One is that if you have symptoms, what do you call a problem-based visit, don't ignore continued bloating, pelvic discomfort, abnormal bleeding. The pelvic exam, including the abdominal exam, checks for liver. You're making sure it's not enlarged, that we don't feel the spleen, that we don't feel anything below or above your belly button, meaning enlarged uterus like a fibroid, or concern about an ovarian mass. The pelvic exam also looks at the vagina, at the cervix. That's how we take cultures. So a pelvic exam, especially in women who've not had a hysterectomy and their ovaries removed, just serves as another method of examining the body, no different than we examine the thyroid gland or the breast exam or heart and lung exam. So it's an important part, and over a certain age, a rectal exam is also important. It's something that a nurse practitioner, certified nurse midwife, or physician, internist, OBGYN can also do. So I'm not sure if I answered that, but yeah, the pelvic exam is where we get cultures for gonorrhea, for chlamydia, for checking for bacterial vaginosis, yeast infection, trichomonas. So it's a part of an exam that physicians do and nurses to evaluate the pelvic floor, the well-being of a woman's anatomy, and should not be ignored.
Thank you, Dr. Bradley. I think that this would be a question for either Dr. Milliner or for Commissioner Mills. Is there a decline of people that are showing up to vaccination clinics?
This is Dr. Milliner. I can take part of that. I think when we started, as anybody can attest, initially there was plenty of people that wanted to get vaccinated and we didn't have enough vaccine. Now we have enough vaccine, but we don't have as many people that are getting vaccinated. I read somewhere recently, I guess depending on the area of the country, there are more people getting boosters than are getting initial vaccines. So I don't think the supply is as much the issue. Now you can get it at a pharmacy or a grocery store, urgent care centers. So the opportunity to get the vaccine is, probably right now far outpacing. I think there was a time when we had too many vaccine and not enough arms to give the vaccine. I think that's probably settled down a lot. I think upcoming with the vaccines are approved for children, you may see an uptick in another shortage of vaccines or more vaccines than people are getting out there, but we hope that we're at a better place now, that we have enough supply for the people that choose to and decide to get vaccinated.
Agreed. There is plenty of vaccine. We have had to learn to pace ourselves as hospitals, health departments, federally qualified health centers, and our ordering process from the state. I think here in Cleveland, the percentage of individuals who are eligible for vaccination who have actually received a vaccination we just made 40%. And so there's a long way to go to get to that 70%. I agree with Dr. Milliner, vaccine is available anywhere. No one should have a reason not to get vaccinated because they can go to all of the places that she identified. If you walk out of your house and there's a Rite Aid, a Walgreens, a Walmart, a Giant Eagle, a Mark's, you can get vaccinated at your health centers, at federally qualified health centers, at the hospital. And so there's no excuse other than making sure that an individual gets him or herself to a place to get vaccinated. The only thing I think that we haven't done is done a middle of the night vaccination clinic where someone can get vaccinated at 3 a.m. But other than that, folks can get vaccinated.
Thank you. Dr. Bradley, I believe this would be for you. If we have a family history of breast cancer, especially being a person of color, is it recommended that we get screened or have a mammogram before the recommended age?
A great question. For two types of cancers that I'm familiar with, we have screening recommendations. So until the last few months, let me just pivot to this. Colon cancer screening was recommended to begin at age 50 to 55. And now, because the number of cases has increased, it is now age 45 to get a colonoscopy. The take-home message is that if you're a person of faith and you have a family Bible, and you talk at the dinner table for holidays with your family, we need to know why your aunt, your grandmother, your mother died. There should be no secrets, especially when it comes to cancer, because how we as your physicians order tests, there is an age that's appropriate for screening. So the age for mammogram would be 40 and above. However, if your mother was diagnosed at age 35 with breast cancer and you're her daughter, you should be screened 10 years before. So the word is not to have every 25-year-old go out and get screened for breast cancer. Or if someone has a father that had or a mother had colon cancer, at a young age, you should step back by 10 years. And you're only going to know that by speaking. There should not be a code of silence around the C word, the cancer word, because as we get smarter, we will look at, are there patterns? Women that have family histories of ovarian cancer may have a higher incidence of breast cancer. So that's what I would like to tell my patients about. Know your family. And if it changes from year to year, and you can let your doctor know, your family history is not static. You meet your doctor for the first time, but if something new comes up, you need to say, can you update my chart, or let me tell you that this cancer, developed in a certain family. So it's the type of cancer and the age of diagnosis.
Great, thank you. Commissioner Mills, can you please shout out the phone number again to volunteer, the number that you had given before?
Sure, folks can call our call center at area code 216-664-2222.
Okay.
Could I just add one thing, as I was just thinking here for a moment? Is that okay? Do I have permission? Okay. I think all of us are talking about, this is Breast Cancer Awareness Month, but I really, as a physician, and the older I get, I get a little bit wiser about what we're doing and why we're doing things. I think the blueprint for beating cancer is to stay healthy from the onset, from adolescence on. 55% of cancers in women, in fact, there are about 12 cancers that we know for sure that are due to our weight, being overweight or obese. And also the risk of reoccurrence and lack of remission from disease has to do with our weight. And the same thing with COVID. When COVID first came out, I looked at myself, and you start reading about all the numbers and what's happening, who's in the hospital, who has the disease. And it's early on, it was people who had many comorbidities. And what are we speaking about? Hypertension, diabetes, being overweight, kidney disease, those are, and also heart and lung, other heart and lung disease. So, you know, I want us not to forget that heart disease is still the #1 killer for women. I do not want to underestimate, you know, breast cancer. This is awareness, but women are dying more from heart disease than they are from breast cancer. And the #1 reason is that we are not managing and treating our hypertension seriously. You know, you can, and also our diabetes. You can't have a quote, a little bit of sugar. It's like being a little bit pregnant. Okay. These diseases have to be so well managed because 12 cancers are associated with being overweight and obese. And you can do as many screening tests as you want. And I'm not putting that down, but we must look at diseases like ovarian cancer, breast cancer, colon cancer, kidney cancer, head and neck tumors, pancreatic cancer, liver cancers. There are many cancers that are due to weight. And I know it's a very much a difficult thing to speak about in our community, but when I look at diseases and other comorbidities, and as I tell my patients from head to toe, our weight matters. Our waistline, is it your weight or your waistline? Our waist, what we carry, and I'm pointing to my belly because I'm working on it. That tissue that's extra that's in there is not sleep, it's not dormant, it's not hibernating. It's making all kind of cesspools of inflammatory cells. And those cells of inflammation from head to toe affect us. Cells of inflammation from our weight increases the risk of stroke, cataracts, heart attack, lung disease. The #1 cause of cirrhosis today is not because you drink too much. It's because of being overweight and obese. Gout, back problems, infertility, pregnancy-related complications, prostate cancer. So I really, your ability to be well and get better from COVID has to be that you need to go into this pandemic strong as you can be. And hopefully the medicines that these brilliant physicians and nurses can give you, if you get admitted to the ICU or a high-risk floor, you can overcome this, that you already don't have all these cells of inflammation. So when I'm speaking to my patients now, we don't want to put a Band-Aid on people. Yes, get screened. You should be screened, but you also have to take care of all these other things to keep us healthy. And I'm sure Dr. Milner can speak about the issues as it relates to children and pediatric and adolescents. We don't want our kids to be overweight. I can't speak to that. That's her area of expertise, and she does a wonderful job with that. But I'm just finding that we do a lot, but we need to do better. And again, that know better, do better. And so look at also alcohol consumption for women. More than 5 to 7 drinks per week increase your risk of breast cancer, since this is Breast Cancer Awareness Month. So, and for women who develop any cancers, and men also, if you're overweight and you lose weight, not because of your cancer spreading, but just to lose weight, you're more likely to be a longer term survivor and do better. Same thing if you want to have a baby and you're overweight, have recurrent problems. So I don't think we talk about that. It's easier to talk about screening, but I want to be real and talk about things that will make a difference. And one of those is this idea of understanding what are the blueprints, what needs to be in our books: movement, exercise, eating well, staying away from fast food, okay? Eating whole foods, eating high grains. I think all of these are the things that really, when we start looking at what can make us better, sugary drinks, we need to, as a culture, get rid of going to McDonald's, going to all these fast foods, cook at home, do things together, teach our children to cook. We can't, as people of color, our ancestors ate from the land. And we need to get back to the things that made us very strong as individuals 400 years ago in this country. And I'm appalled at what we are allowing in our communities. This has nothing to do with anything, but I have to say this because I'm ashamed to drive. I grew up in the Lee Harbor community and originally right down by the Cleveland Clinic. And last night I came from a funeral coming across Lee Road to get to my home. Over 9 fast food stores, almost within a half a mile. We shouldn't be going there. Sugary drinks, all of that stuff, we should be doing better for ourselves. And saying no to advertisement, to marketing, which is gearing us to an early grave. And that I do believe, and I think it's here now that we can reverse the things and prevent a lot of problems and decrease risk. We have to take ownership of us. We're given one body, we're given one opportunity. None of us are going to get out of here alive, but we want to live life to the fullest. What's happening in America, we're just dragging out life. People are on dialysis. Look at all the dialysis centers in the Black community. It's embarrassing, okay? We need to say, stop it, okay? Take your medicine, do what your nurse and doctor say, because it's all for your own good. And I love these sessions, but I want to make sure we are not losing sight of our whole well-being from top to bottom and not be stuck on one thing. We have to work together in order to be a global citizen in order to stay well. And what we're feeding our kids in school, I could speak an hour on this, but I just want to make sure this is such an important topic for breast and screening and COVID. All of this stuff comes together. It's being educated, as Lynn had said. You got to know what you need to know and do what you need to do to stay healthy and to live a life brightly until your light just goes off, and not a life of chronic disease. And I'm very passionate about that, as you see. So take care of you.
Okay, we have a couple of questions, but what we'll do is we'll make sure that we get the questions and we'll make sure they get answered at a later time, because I know that we're almost to our time. So I'm going to turn the program back over so we can have our closing remarks.
All right, thank you. Thank you everyone for attending. We hope that the information shared today from these trusted voices have helped you to make a decision about taking the vaccine and getting annual screenings for cancer, for we know that early detection saves lives. If you have any additional concerns or questions that have not been addressed here, please email us at chp@ccf.org. That's chp@ccf.org, and you will receive a response. Thank you all for your engagement, participation, alliance, and commitment to keeping healthy.
Thank you, Cicely. We appreciate so much this collaboration this evening, and all our participants. Again, we just want to thank you. We're here now to just encourage all of our sorors community and friends to please come out to our Healthy Women Build Healthy Communities Health Screening and Immunization event on Saturday, October the 30th from 9 a.m. to 4 p.m. at the Langston Youth Health Center. And you see the address there is 2390 East 79th, right on the corner of Quincy and East 79th Street. If you're coming to get a mammogram, a PAP, or a pelvic, you must register. If you have a family member, someone you know that doesn't go to the doctor regularly, this would be their time to come, whether they have insurance or not. Please get them registered. We are doing everything we can to possibly make sure that everyone stays safe. So you must wear face masks, and only those receiving services along with one other person will be allowed in the building. We will be serving breakfast and lunch boxed, again, to keep it COVID safe. There will be some lovely t-shirts there. Red goes pink for breast cancer is what we are saying that for that. And so we're really excited. So we really want people to start getting registered now. There's only so many slots. I also want you to know, if for some reason you cannot get registered for October 30th, if we get full, we have regular mammogram clinics at Langston Youth. Next slide, please. So Langston Hughes Outpatient Care, again, is at 2390 East 79th. And we're really happy and excited to share that we have primary care services for adults and internal medicine. Again, we have wraparound services. There is a mammography clinic there. We're doing health education. We have social work and behavioral health, patient navigation. If you have any issues or questions, feel free to call any one of the numbers at the bottom of the screen, 216-361-1773. And the big thing is you don't have to pay for parking, sorors. But again, we are so excited. You can come in every Monday at Cleveland Clinic Langston Hughes and get your COVID vaccine or your booster shot. We're open on Mondays starting at 7:30 a.m., I believe, until 12:30. You don't need an appointment. You can just walk in. So I went to work on Wednesday and on Tuesday, and I was able to walk in and just get my booster. It only took maybe 20 minutes at the max because you have to wait 15 minutes after the shot so they can make sure they check you out. So we, again, want to thank everyone who participated tonight, all of our panelists, all of our SORs, all of the community. And we just hope that this educational moment allowed you a chance to really think about your health and how you can move forward. Again, COVID vaccine information, you can call Cleveland Clinic, COVID-19 vaccine website at clevelandclinic.org/COVID vaccine, or feel free to call 216-448-4117 for a vaccine appointment. Again, we thank you and have a good night.
Thank you.
Thank you.
Thank you.